Children's Jubilee that we were talking about. Before joining Voices for Children, Emily worked at the Roadrunner Food Bank. All great people work at the Roadrunner Food Bank and Central New Mexico Community College. So welcome so much, Emily.
Thank you, Judy. Thank you so much. Get my notes. All right, I got my notes here. Let me get situated so I remember what I'm telling you guys about. Well, good morning. It's really, really great to be here with you all. Thank you so much for inviting me, Carlos. I'm really happy to be able to share a little bit of some of these wonkier things with you guys, the child tax credit, and a little more about the WIC program. So like Judy mentioned, you know, I have grown up in New Mexico. I like to share a little bit about myself. I grew up in southeast New Mexico in Roswell, so if you know what that's about. I lived in Las Cruces for about 6 years, part of that time being in school, but I've been in Albuquerque now for nearly a decade, which is kind of crazy to think about. And I met my husband while I worked at Roadrunner Food Bank, actually, and we have been married about 6 years, and we're obviously expecting our second. So I started at Voices days before the pandemic shut us down, so I've been there for exactly the length of time since we all got introduced to COVID-19. And as mentioned, I lead our Kids Count work, with that second half of my title being Kids Count Coordinator. But I also lead our K-12 and higher ed policy work, and then I lead on our food security work, which is how I'm plugged in with all of you wonderful people, getting to work together to help folks have more food security in their lives. So yes, perfect, that's the slide we're on. So you guys are probably pretty familiar with New Mexico Voices for Children, but just in case there's anyone in the room who isn't, our mission is to champion public policies that improve the well-being of New Mexico's children, families, and communities. And so you may be wondering why an organization with this mission is working on tax policy. It's a good question. So we were actually founded about 40 years ago by pediatricians, and they were seeing kids come into their office with these problems and illnesses that could have been addressed upstream if we just had stronger policies in place that could support kids and families to really thrive. And so New Mexico Voices was born out of that. And we started focusing on health policy, obviously, but also education and family economic security, with that realization of the interconnectedness of those things in allowing our kids to be healthy and to thrive. But you know, we'd get up to the roundhouse and we'd ask lawmakers to support policies that would help our kids and families, and we'd often hear the same answer. We would really love to, we really support that, that'd be so great, but we don't have any money in our state. And so we had this idea to start working on tax and budget issues, because we want to make sure that the state is working to lessen our reliance on oil and gas, to equitably raise adequate revenue to support the kinds of programs that can improve the lives of our kids and families, and to have a tax code that's more fair, so that the folks earning the lowest amount of income are not paying such a high proportion of their income in taxes, but the folks at the top are paying their fair share, and the companies are paying their fair share. So we got really invested in that work, and so we continue to work on the policies that improve health, education, and economic security. But all of that's done under this umbrella of raising sustainable revenue and improving tax fairness in our state. So with that, perfect, that's the right slide. Little bit of background. I want to start with just kind of an overview of the child tax credit, the CTC. It's a really powerful anti-poverty tool. The federal CTC was established in 1997 with the intent of supporting families with children by offering that tax credit, and the intent being that the credit would incentivize work, really, for these families. And the credit is intended to provide that extra bit of income to improve economic security and improve things like food security and having basic needs. The credit is really not indexed to inflation for the most part, so there's a little bit of an exception. The amount of credit that families with children under 17 can receive as a refund, so the piece that they can actually get back as cash will increase annually with inflation until it equals the full value of the credit. So there's a little bit of an adjustment there, but the actual maximum credit doesn't ever adjust with inflation, which makes it lose its power over time. In 2017, the child tax credit was doubled to $2,000 per child from $1,000. That was through the Tax Cuts and Jobs Act. And $1,600 of that is refundable, which that just means that if the credit exceeds the amount of taxes owed, then the taxpayer can receive up to $1,600 of the balance as a refund. But the Tax Cuts and Jobs Act is expiring next year in 2025, and the child tax credit will return to its previous form at $1,000 if no action's taken. And at that time, taxpayers will only be able to claim the CTC up to $1,000 per child. So, as was mentioned by Carlos, we all know a big component of pandemic relief legislation was to temporarily expand the federal CTC in 2021. And at that time, it was actually expanded to $3,600 for kids under 6 and $3,000 for kids up to 17, and it was fully refundable, so families could get that whole amount back as a credit. And it also did something else really important. It removed the minimum earnings requirement, which is the requirement that a family has to make a certain amount of income in order to even become eligible for the credit. So it has been historically limiting the people with the lowest incomes from accessing the credit. And during the pandemic, that requirement was waived. So we saw huge amounts of kids becoming pushed above the poverty line and leaving poverty because of this. Those temporary expansions, they expired in 2022. And so what we know about that is in 2021, the CTC lifted 5.3 million children out of poverty. But in 2023, after the expiration of expansions, it only was able to lift 2.4 million kids out of poverty. So it cut that back in half and put those kids back in poverty because of inaction in Congress. Next slide, please. Cool. So I want to go over a little bit more of the kind of mechanics and details of how the federal CTC works. Like I mentioned, there's that minimum earnings requirement. And right now, that means that families who earn less than $2,500 annually, who are the families that really need the most support, are ineligible to claim the federal child tax credit. The credit phases in at a rate of 15%. So what this means is for every $100 above $2,500 in earned income, the taxpayer will receive $15 in child tax credit. So as you even become eligible, you're earning very small amounts of child tax credit until you reach a threshold that Congress has decided means you are worthy to receive the whole amount of the credit. There's also a phase out at this point in time. The credit is reduced by 5% of your adjusted gross income once a family crosses a maximum income threshold. And that's currently set really high with the Tax Cuts and Jobs Act. It's $200,000 for single parents and $400,000 for married couples. But when that act expires next year, the credit will not only be cut back in half to $1,000 per child, the phase-in will actually begin at $3,000, so it'll cut some more of our lower income folks out of being eligible for the credit. And the phase-out will begin much earlier at $75,000 for single parents, $110,000 for married couples. So this is just going to further limit the number of kids who could really benefit from having the CTC in their household, that could have this extra money available to support their food needs in the home. I want to share this statistic. Currently, about 37% of kids in New Mexico are living in families with incomes that are too low to qualify for that full federal child tax credit. So we fully have 37% of families who cannot qualify for that maximum amount of $1,600 for their kids. Most states that have this high of a rate of kids in families that can't qualify for the CTC are, no surprise, in the South. There are states that have very high child poverty and really large populations of children of color, so you can see how those systemic issues of racism have been really built into this policy and have allowed us to continue seeing that gap grow between our folks with the least and folks with the most, particularly when you look along the lines of race and ethnicity. Kids who are excluded from the full CTC are disproportionately young children, they're children in single-parent families, and they're children in rural areas. As I mentioned, during the pandemic, the temporary expansion to the CTC lifted 2.9 million more kids out of poverty than it does today. And in New Mexico, that temporarily expanded CTC benefited 412,600 kids in total, and it lifted an additional 32,000 kids in New Mexico out of poverty. So when that expansion expired, those 32,000 kids dropped back below the poverty line. We'll go to the next slide, please. So this is for my visual learners in the audience, so if that was a lot of jumbled numbers for you, I want to explain a little bit about this graph. It basically shows the structure of the credit that I was getting at. And this is an example of a two-parent family with 2 kids. So that means if a family qualifies for that maximum credit of $2,000 per child, the credit is $4,000, which is that top line there. So that's the families that are able to get that full credit. And you can see from the shape of this structure, this kind of trapezoid, that the federal CTC is not progressively structured. A progressive structure would just mean benefits higher for our low-income folks and declines as income rises. And that's not what we see here. That's not how this is structured. So you can see some families on the left side of the graph are too poor to receive any credit. Some of them fall in that phase-in range that kind of rises there. It looks to be around $40,000 to $45,000. And then you see a plateau where families in a really large range of incomes are able to benefit from the full credit. And you see the phase out starting at that $400,000. And finally, when families earn too much to qualify, around $475,000. And that is reducing, at least at the end, right? So they're not getting the full credit. So again, this is under the current law, the Tax Cuts and Jobs Act, that's going to expire next year. And at that time, if the CTC reverts to its prior structure, if we haven't convinced Congress to pass a better version, that would lower the maximum credit in this chart, since it's a two-parent household with 2 kids, down to $2,000, cutting the benefit in half. It would revert to a higher point of phase-in, so families would be earning slightly more to qualify, and it would have a much earlier point of phasing out. So if this plays out, again, we'll see some number of kids, probably not insignificant, dropping into poverty as their family loses access to the CTC. Next slide, please. Some good news for us is that New Mexico has created our own state-level CTC that's designed to really respond to some of the shortfalls we see in the federal version of the credit. We created this in our legislature in 2022. And in 2023, we actually expanded the amount that families can receive, and we indexed it to inflation, so we don't lose the spending power of our CTC in our state. We're one of only 15 states with a state-level child tax credit, so we are really leading the way in this. And our credit is obviously much smaller than the federal government, but we have a credit that ranges from $25 to $600 per child. It's fully refundable. There is no earnings threshold where the credit phases in. So a family with no income would be eligible for the largest credit of $600 per child as long as they file their taxes. And as the income increases, the credit decreases down to $25 per child, so that's a progressively structured tax credit. Families with the lower incomes with the most need receive the larger amount. The families at the top of the spectrum get $25. So we are really proud of that tax credit here, and our state CTC will return an estimated $175 million annually to families in New Mexico, benefiting 475,000 children. And that's essentially all of the children in New Mexico will benefit from this credit. So we'll move on to the next slide and talk a little bit about WIC. So WIC, as you guys probably know much more about this one, is a targeted food assistance program designed to improve nutrition and health for mothers and young children. First piloted in 1972, it was a response to a growing concern among our leaders about malnutrition for mothers and young children living in poverty. And so in 1975, it was established as a permanent program. WIC is funded through the United States Department of Agriculture, like SNAP, but SNAP's an entitlement program. So basically, when the government does not manage to put together a funding bill, SNAP continues on for some amount of time because it is an entitlement for folks. The benefits are guaranteed. WIC, however, is not an entitlement program. So the annual funding levels established through congressional appropriations are really important. Those end up being distributed to states as block grants. And in New Mexico, we manage our WIC program at the state level primarily, but there are a few tribally managed WIC programs as well. I just mentioned that because some states have WIC programs in every county, they have them regionally in the state, there's lots of different structures, and we have a more kind of centralized version of how we operate WIC. There's pros and cons to both of these structures, but this is the one we have, just for your own knowledge. There have been a lot of changes to the WIC program over time. The most notable recent change I'll mention is just the introduction of a new food package. And the food package is basically just this menu of food items that are available to a participant kind of based on what category they fall into. Are they pregnant? Are they exclusively breastfeeding? Are they partially breastfeeding? Do they just have children under 6, excuse me? And there's different things that come from those food packages based on the unique situation of that family, how many kids are in the house, etc. So the other thing that was really good about this new food package, it included a larger portion of benefits available for fruits and vegetables, and this is called the cash value benefit. And there were other improvements just to meet current dietary recommendations. So those were all really good changes that have happened recently. The WIC program is targeted to pregnant and postpartum people, infants and children up to age 5 who are living at or below 185% of our federal poverty level, or they're enrolled in temporary assistance for needy families or TANF, SNAP, and or Medicaid. Applicants are then screened initially, and they have to go to appointments every 6 months in person to recertify. These appointments and screenings are done by health professionals, and they're looking for medically based risks, such as anemia, being underweight, smoking, maternal age, history of pregnancy complications, or poor pregnancy outcomes. And they're looking for diet-based risks, such as just not consuming the recommended amount of protein or iron in their diet. And there are lots of benefits from participation in WIC. It reduces premature births, it reduces low and very low birth weight babies, fetal and infant death is reduced, and the incidence of anemia is reduced. It increases access to earlier prenatal care, the consumption of key nutrients for pregnant people, increased immunizations and access to health care, and it improves diet quality. So all of those benefits are not only good for the health of the mother, but they have really long-lasting benefits for kids coming out of it, that they are healthy, that can prevent some later poor outcomes in their life. And it provides this window of time where they have additional food support in their households. In New Mexico, we do see a large number of folks dropping off of WIC after children are no longer infants. It's used a lot to supplement formula needs. Formula is incredibly expensive, so once they don't have infants on formula, going every 6 months in person to recertify for a benefit that provides very specific food items can be less of an incentive to keep you engaged in the program, and the benefit isn't incredibly high. So moving on to the next slide, a little bit more about New Mexico's WIC program. There's actually some, again, exciting news about stuff New Mexico's trying to do. So I want to just first of all flag that our WIC program is housed in our Department of Health, but that means it's managed under a separate agency from SNAP and TANF and Medicaid. And those are all managed by the Healthcare Authority. And so you might be thinking, well, that's unfortunate, since being enrolled in those programs means you're eligible for WIC. The good news is, over the last few years, New Mexico has really worked to make sure that information's being exchanged between the Healthcare Authority and Department of Health. So this is happening by the Healthcare Authority sending referrals for people who may be WIC eligible over to Department of Health when they apply for SNAP, TANF, or Medicaid and are deemed eligible for those programs. So it's eliminating a step of folks having to go locate another resource. They're getting kind of that direct follow-up, even though it's through a different agency. And this has led to 11,000 more WIC participants over just a 1.5 year period. That's reversing a decade-long trend of declining participation. And we were actually the first state to link the participants between these programs. So once again, despite what you might hear about New Mexico, we are leading the way in a lot of these things. Other recent changes include some key modernizations to improve the experience of WIC participants. So you heard Carlos talk about some of those things you can ask for them to do to improve the program. New Mexico is working on doing those things regardless of what the federal government says about the program. So they created an app for their participants. So we can now have WIC participants who schedule their appointments online, which just solves for some other problems. They can upload documents there, so they don't have to remember to take them to their appointments. And there's a food shopping guide that they can access. And there's also now an option for using your phone to make your WIC payments at farmers markets, which is really exciting too, especially with that increased cash value benefit to buy more fruits and vegetables. And now you can really access those locally grown things using your WIC benefits really easily. One of the silver linings of the pandemic is that curbside pickup, online shopping, and self-checkout options are becoming really more standardized in stores that accept WIC. So folks can shop online, pick up their groceries, and they can go through self-checkout, which was not a thing that they could do a few years ago. You had to go through a line with a cashier. Some of the pandemic-era expansions in the food package, we were able to, in New Mexico, make permanent. We have a pretty expansive food package as far as the parameters of what's allowed. So there's just more variety of foods that our WIC participants in New Mexico are able to access. And that larger cash value benefit that I've mentioned a couple times to buy fruits and vegetables, as opposed to the value of very specific item prices that you get for other items for WIC, that's really translated to huge increases in purchasing of fruits and vegetables for New Mexico's WIC participants. So getting more fresh food, as we all know, is really important and beneficial to the health of a household. So the only bad news here is that there's still challenges in our rate of coverage of folks who are eligible for WIC versus who's actually accessing it. And our most recent data tells us we have 90,400 people estimated to be eligible for WIC in New Mexico, but only 35,400 are participating, and that puts us at a coverage rate of 39.1%. The national coverage rate is 53.5%, so we still do have a lot of work left to do to make sure that eligible people are not only enrolling, but that they're staying enrolled in WIC as long as they're eligible, that we're removing any barriers that are causing them to drop off the program early. So I'll go to the next slide. I've got another graph for any of my fellow data people out there, but I want to talk a little bit about how these effective policies are improving poverty. Basically, why do we care so much about the child tax credit when we think about food insecurity? Well, it's getting cash into the hands of folks to go out and buy the things they need, which is often food. The WIC program is supporting that additional supplement for purchasing food specifically, but we know that people are still experiencing poverty. And by that we mean their incomes alone are very low and they're very far from sufficient to meet those basic needs. And policies like the CTC and WIC are really effective anti-poverty policies that go a long way in alleviating poverty for many of our kids and families. And when you combine those with several other policies that are really powerful, other tax credits, benefits like SNAP, they really dramatically improve what poverty looks like in New Mexico. If you are looking at the measure of poverty that actually includes our tax credits and benefit programs. So there's a narrative we all know that New Mexico is the poorest place in the country. And that's by one measure of poverty. And it is a valuable measure of poverty. It does tell us that our incomes here are incredibly low and are not enough to give us what we need. That is the official poverty measure. That's the one that folks are most familiar with. It's used for eligibility for program participation. It's the one that this narrative comes from. It's been around since the 60s. But there's a second measure that nobody really knows much about. It's still relatively new. It's called the Supplemental Poverty Measure. It was started in the 2000s. And while the official measure is only looking at your pre-tax money income, the supplemental measure actually takes into account the impact of tax credits and benefit programs. It also counts for some typical household expenses, like your expenses on childcare, what you pay in taxes. And it also has an adjustment for geographic differences in housing costs, which really vary across the nation and really change what the picture of poverty looks like for folks. So this all means that that second measure, the Supplemental Poverty Measure, or the SPM, that means that measure is really giving us a more accurate picture of poverty at this time in our state. So not at all to discount how strong the impact of low wages are on our families. We would love to see them have higher wages and not need benefit programs in the long run. In the meantime, kids that are in families that are receiving these benefits are having that impact of poverty alleviated in the short term. So you'll see something interesting on this graph. I love this graph. It's my favorite thing to talk about. I've been talking about it a lot lately. So some of you, bear with me, may have already heard me go on about this. That dotted orange line that you see is the US official poverty measure, or the OPM. And the dotted blue line is New Mexico's OPM. So that shows us that narrative we all are used to hearing. You see that New Mexico's poverty rate is sitting way higher than the US. But if you look at the solid blue line that's kind of bolded there, which is New Mexico's supplemental poverty measure, you see our poverty rate drop substantially. It's sitting down there among the other poverty rates that are the US official and supplemental rates. And what you see here is that New Mexico's official poverty measure for our whole population is 18.5% compared to 11.4% for the US. But when you compare New Mexico's supplemental poverty measure that counts our tax credits and programs like WIC compared to the US, New Mexico's poverty rate is 10.9% compared to 11% for the US. So we are right there with the rest of the nation. And this year, it's not on the graph because it was the first time we got data that showed our state level OPM and SPM for our kids. Turns out that difference is even more dramatic. When you look at our New Mexico official poverty measure for children, it's 27.4%. It's the worst in the nation. We know this. We've heard this. We've heard this for our whole lives. And the US has an official poverty measure of 15%. But our supplemental poverty measure for children in New Mexico, because of all these programs, is only 8.9%. And that's compared to nationally, the rate being 10.4%. So we are doing better than the nation as a whole when you look at how we measure the impact of these kinds of critical programs on our kids and families. It's really exciting news, and I don't think it should be glossed over or understated. At the same time, we can't devalue the fact that our official measure is so high. Getting incomes raised for families is really critical. But the point is getting the cash resources or the non-cash benefits into those households in any way we can to alleviate that poverty in the short term, because so much can be insulated from harm from our kids when we do that. It helps alleviate child maltreatment. It helps prevent all sorts of maladies that we know exist for our kids. If the family's economically secure, that alleviates a lot of problems that are most detrimental to kids when they are at their youngest. So that is why we care so much about strengthening the child tax credit and WIC, especially in New Mexico. We have a really vested interest in that. You can go to the next slide, please. These policies clearly matter. New Mexico has really leveraged our federal programs like the CTC and WIC, and we really continue to focus on how we make sure they're lifting as many people as possible out of poverty. New Mexico is also really good at taking advantage of any waivers, adding on policies locally that piggyback. We're really doing a lot of great work to ensure that our kids are in families that have what they need to thrive. There's more progress absolutely possible. It's really necessary to improve access, to support strong implementation of programs, and to remove barriers that prevent people from accessing support. And we want to maintain and expand these policies depending on what's appropriate and what's politically feasible. So we'll go on to the next slide here. So along with just flat ensuring that funds aren't cut, there are a few broad recommendations that I like to just add for additional advocacy and support as you start thinking about your letters that you'll be writing. We know when the pandemic era CTC expired, Congress chose to allow millions of kids to drop back into poverty. Poverty is a policy choice. So we should advocate for similar expansions to the federal CTC to be made permanent as we approach the expiration of the Tax Cuts and Jobs Act. So we want to see that rate go back up to what it was in the pandemic, no minimum earnings requirement, fully refundable credits. We know that that doubles the number of kids kept out of poverty through just one policy choice. Every year it's important to keep track of Congress's budget recommendations for WIC since it's not an entitlement program. Most recently, I believe the FY25 WIC appropriations bill has moved out of the Senate in a bipartisan fashion that is fully funding the program, but we want to keep an eye on that and make sure it doesn't get cut on the House side, doesn't end up turning into something else that we don't want to see. So always being able to advocate for full funding for WIC and paying attention to keep the pressure on so we avoid any harmful cuts. Like I mentioned, New Mexico's done a really good job of creating more variety in our food packages. We've taken advantage of federal changes, and we avoid unnecessary limits to WIC-eligible items. States have some freedom to pick what goes in their food packages, and we tend to pick everything that's allowed, which is really nice. But we want to continue supporting opportunities to improve and expand what items are eligible for WIC, and especially to continue to make sure that higher cash value benefits for fruits and vegetables remain included, since we know how critically important that is to the health of participants. We can also support continuing efforts to streamline WIC certification, which again, Carlos mentioned as part of the opportunity in your letter writing campaign. Again, New Mexico is doing some really good things, but participants are still having to go to their appointments and be recertified every 6 months. So really helping to keep eligible people enrolled in the program. New Mexico is doing innovative things like that online scheduling through the app they've created, but they're also planning to create telehealth options for their recertification appointments, which would make such a huge difference, especially for our folks in rural areas where there's a long drive to get to the WIC clinic to get recertified, other just structural barriers that exist. So if there are opportunities to support either at the federal level or in New Mexico those improvements, we want to take those and advocate for that support. And the last thing that I'll mention is just a state level policy you can support, and that's efforts to increase New Mexico's child tax credit specifically for our youngest kids. And that's because children under 6 tend to have a greater likelihood of living in poverty. So if you target the increase in the credit for this age group, that would specifically help address the gap in poverty rates between our youngest kids and all of our kids as a whole. So with that, I think I stayed on time. I can go to the next slide. Thank you all so much for having me here today. I really appreciate you, and my contact information's here, and I think we have time for questions. So I see a first one back there.
Federal child tax credit, which I understand it should be set up differently, but that seems like a very high income level to get that child tax credit. Is that my imagination?
No, it is a really high level. That's one of the kind of funny things about it, is because it's supposed to be federally, their goal is incentivizing work, so they want to keep rewarding up to a higher income. I don't think we need to keep that phase out so high myself, but we should allow people to come in earlier for sure.
So if we're writing letters and we're saying we want you to expand that to pre-pandemic levels, I might have a hard time with that.
Yeah, and you can ask for instead that they just again remove the minimum earnings requirement, and that they allow it to be fully refundable for everybody eligible. You can even say, cut the limit back, if you want to. Yeah, there's several other options. You can do some research online of other bills that have been tossed around and presented in the last couple of years, and they might have something more in line with what you would like to support.
Everything else is great.
So Emily,
Yes, sir, Kurt.
yesterday or the day before, I heard for the first time a state, the Secretary of the Healthcare Authority use the word, or the term, supplemental poverty
Yes.
measure. You probably heard that as well.
Very
And
excited
she
about
also
it.
mentioned that healthcare is not a part of that measure.
That's
and
correct.
the reality that we've expanded Medicaid here. Can you speak to that just a little bit and what impact that might have on it?
Yes, I can. Thank you for both highlighting that it's getting some traction and folks are talking about it more, because that makes my life really exciting. I've been really invested in this supplemental poverty measure for the last several years of my job, and it feels like people are starting to catch on. I'm very excited that it's getting some public attention. But that is correct. So the things factored into the supplemental poverty measure, Medicaid is not one of the benefits that's counted there. What is counted in the supplemental poverty measure is one of the expenses, and that's medical out-of-pocket expenses. So if folks are on Medicaid, they're going to have a lower medical out-of-pocket expense, so that is going to be somehow captured. But for some reason, the census kind of does a whole separate calculation about the impact of health insurance on poverty. And I haven't looked a whole lot into that yet, but you can find some information. If anybody's interested, somebody recently forwarded me this separate report about that specific issue, and you can email me and I'll send it to you. Or you can ask me to write your name down later. Yes.
I'm sorry, what do you mean by the term fully refundable? I didn't catch that.
Yes, so fully refundable just means that the entire amount of the credit, so right now it's set up where the credit's $2,000, that basically means your tax liability gets lowered, but if you cross a certain earnings threshold, right now you can only receive $1,600 back in cash. If it was fully refundable, you'd be able to receive $2,000 rebate right out the gate. So we want it to be fully refundable so that that top number is the number you are eligible to get back. Yeah. Oh, we've got one right here.
Probably a dumb question that everybody knows the answer to, but I don't. Can undocumented women and children receive WIC?
That's a great question, and the answer is yes. For a while, there was a big problem with that public charge rule that talked about undocumented folks. If they were known to be using public benefits, it could cause problems with any future opportunities for citizenship. But that has since, I believe, gone away, and you can access it, yeah.
Is part of the reason that so many people are not getting those benefits because they don't even know about them, or are they afraid to apply for them?
Yeah, I think there still is a remaining chilling effect from that public charge rule, so I think there are still a lot of folks that are worried about it. There's a lot of stigma still attached to WIC where it has lessened on other programs, I think because it is about health and nutrition, so women are having to go into a clinic every 6 months to make sure they're being looked after in a way to get the benefits. And then by the time you get to the store, the food package system can be so confusing. There's an item of food, you're eligible for it, but you pick up the wrong size. You haven't been able to go through self-checkout until recently, so you're stuck with a cashier who now can't do the transaction. There's a lot of embarrassment that comes up with having people watching this happen. And so I think that has been a big part of the issue as well. There's also this idea that folks abuse WIC benefits and create a black market of baby formula, which the benefit is so difficult to get that doesn't really track for me, right? Why would you take this time to get a low benefit to do something shady with it? It doesn't, and it's still getting baby formula to somebody. So there's a lot of factors that kind of go into play that still really limit people's interest in applying. And then just the flat out issue of our infrastructure in New Mexico being incredibly rural in communities. It might just be such a trek to get to the clinic to get certified that alone outweighs the benefit you might get by participating.
If a woman gives birth to a baby in a hospital and she's undocumented, does someone come in and tell her at that time that she can get WIC?
Yes, yeah, there's a lot of hospitals, and it's kind of different hospital by hospital, but there's been a big push to make sure that providers are sending someone in to talk to families about benefits they might be eligible for, specifically WIC. Yeah.
Yes.
Oh, yes.
My question, I'm so proud of the child tax credit that we have in New Mexico. And I just wonder if you would talk about how advocate groups like New Mexico Voices for Children, how did you help shape that policy?
Yes, we did. That was our bill that we led on. So, doing this tax work that we talk about, we know kind of all the key players in the tax committee. We've made relationships with those folks, and especially coming out of the pandemic, it was a pretty easy sell. You have the numbers to show how impactful it is. And we also do a lot of work training our partners around tax advocacy specifically. So we had so many partners involved in applying pressure and supporting the bill. And that makes a huge difference in the Roundhouse. When you all show up in Santa Fe to support a bill, that makes it a lot harder for them to say no to it. Some of them still will, but it makes it harder. And this in particular was a really, really good policy. There was kind of no arguing that we needed it. And so we were really fortunate to be able to kind of lead the charge and get all of our partners involved in supporting it and seeing it passed. Yeah. Oop, there's one behind you, Carlos, and they'll come to you.
I was just curious about the federal child tax credit and what was the reasoning for having so many people in the poverty level not being able to get child tax credit?
Yes, that's a great question with a frustrating answer. The original credit you saw was passed in 1997, and there was this idea really prevalent at the time of the welfare queen, which probably folks remember. So all of the benefits created in the 90s really had this strong work incentivization factor built into it. So basically, what they're saying in the budget when they structure the child tax credit this way at the federal level is that what they value is how much money you can make, and they don't value caring for somebody's basic needs if they don't make enough money. They value you as a worker over everything else. And that shows up in the structure. It's a equity issue. It's a stigmatizing issue. It's an issue of what is it that we care about in our communities, our society? Are we really just trying to help the poorest people have what they need, or do we think they need to earn it? And I think that's still really baked into the federal credit. Carlos had one up here.
Yeah, one of the efforts to improve WIC is modernizing WIC. And I know part of that would be through, you mentioned telehealth and things like that. I know that states like Alabama have an app that people can use to enroll in WIC, or someone from Alabama was in one of our calls saying that their app is outdated, so they need to update their app.
Right.
But what tools do we have in New Mexico to improve access through technology?
Yeah, that's a really good question, and it's a tough question because we have so much challenge with our broadband access, so it'll only get us so far on its own. But we do have an app too, but our app is new, so hopefully that means it's not out of date. And they've been really working on moving us to that, what was the phrasing, the electronic, like adding the benefits electronically, because right now, I think it's still true in New Mexico that to get your benefit card even refilled, you have to go in physically to do it, instead of like with your SNAP card, how it just automatically refills. So that's the thing that the state is working on. I'm not sure where they are in the plan, but they're trying to transition to that to make one less stop you have to make at the clinic to refill your card. And then they've got this app that they're really planning to build in a lot of those things, so it's kind of like a one-stop shop app is the idea. And then that whole communication between the Healthcare Authority and the Department of Health to send referrals across for folks that are in SNAP, TANF, and Medicaid over to DOH for WIC. That's all happening through the online referral systems too. Yeah. So I don't know much more about technology, unfortunately. I can't share a lot more, but that's what I know.
Hopefully the federal program is going to provide resources for
Exactly. That's what we want to see, is the feds providing the money to make those things happen.
Any other questions? We have time for about one more, maybe?